Now, we'd shown you earlier that you had a relatively bad for you catastrophic experience last year. This slide just breaks down the top high-cost cases by diagnosis. And the diagnosis here is the diagnosis attached to the highest cost claim. And typically that's a hospitalization. So for instance, the very first diagnosis here was a case for about $230,000 of somebody with acute myeloid leukemia. And I remember I mentioned that hematology was one of the high-cost categories for you. And that's not usually a high-cost category, but because of this high-cost case, that's why it showed up as the third category on your list. The next case here is something called Encounter for Anti-Neoplastic Chemotherapy. Well, that's a cancer patient getting chemotherapy, also very high cost, about $220,000. Now the third one is, this is painful respiration. What the heck could that be? Well, that's probably an admitting diagnosis for somebody who turned out to have a very serious illness, was in the hospital for a long time, but the admitting diagnosis doesn't really tell us exactly what the underlying problem is. So we could look in our case management database and try to find out more about what's going on with that case. Presumably they had some kind of pulmonary disease or cardiothoracic problem that was precipitating the hospitalization, and clearly was a serious problem because they ended up in the hospital for a long period of time. Likewise, the fourth case, non-healing surgical wounds. That's somebody who had a surgery, came back in with a complication, non-healing wound, and that of course can be very difficult to treat, and sometimes it requires a long hospitalization as well. So anyway, I'm not going to go through all these cases, but if you have any questions about them, I'm glad to answer them.